Okay, welcome to the special meeting of the Board of Health, November 28th, 2023. Ms. Marsh, roll call, please.
First, the statement of the Open Public Meetings Act. In accordance with the requirements of New Jersey's Open Public Meetings Act, a notice of the special meeting was filed in the office of the Township Clerk, posted on the bulletin board in the municipal building and on the Township website, and mailed to all persons requesting notice in accordance with Township policy. 48 hours notice of this meeting was also transmitted via fax or email to the Suburban Trends and Daily Record newspapers. Notice of this meeting included a statement that the purpose of this meeting is to review the Pequannock Township Health Department annual report and that no formal action will be taken.
All right, thank you so much. Roll call, please.
Mr. Dreesy?
Present.
Mrs. Florence Lynch? Here. Mr. Hurd is absent. Mrs. Russell? Here. Mayor Cole?
Here. Items next on the agenda is items for discussion, and I'm going to turn it over to our health officer.
Yes, thank you very much. In the packets you guys received, we have the summary of all the activity that we've had for the course of 2023. And as in previous years, we've completed all the mandated requirements. We've gone above and beyond. Anything that's an elevated public health risk, we do well above what's required at a minimum standard. And so we're going to continue that tradition. It's an important policy that we have in place, and that we're going to keep moving forward with that. In section 1, I provided a summary here to give you a little bit of a supplement to this vast report that's got a lot of numbers and shows all the activity we did throughout the course of the year. But the summary is something I'd like you to just take a look at. Section 1 of the summary deals with all the mandated activities that are required, all the things that we accomplished throughout the year that are mandated. Section 2 of the summary pretty much talks about the disease control, emergency response that we've been engaged in, that we were always engaged in, but in the summer, it's a little, each season has its own challenges. We're moving into a winter season, which primarily is respiratory illnesses. COVID is still there, but it's become all these subvariants of COVID, which are offshoots of Omicron, are very much like the coronaviruses that we've had for 100 years. The seriousness of it is greatly reduced. Hospitalizations are way down. So the concern with COVID is the concern that you have with coronaviruses. It's a little more severe, especially with people who have underlying conditions or of age. So they have to take some more precautions than what we experience with the common cold, which most of the other coronaviruses are concerned. But we also are looking at RSV, flu, and right now it's been fairly mild. The season's kicked off slowly, which is nice. So hopefully we'll have a less than average impact this winter. The next section, 3, again, that's the emerging threats that we really just talked about. And what we do for disease control, which was really in the other section, but disease control, we do all kinds of things with audits and health education, our inspections, and we're out there to really reduce the instances of disease, the prevalence of disease in the community, and that's always being done at a high level. The staff, the health department staff's still performing, has always performed at a high level. I'm really lucky to have a staff that's dedicated, they're credentialed, and we've really done a lot of good work the last 3 years, but I'm excited about what's coming, and now that we have the scourge of the COVID pandemic behind us, we can start directing to a little bit more proactive activities to help the community further. The last part of this summary, I just want to bring to your attention some additional achievements that we've had.
Yeah, like 4B. That's nice.
Yes, that's a great one. The first one is we expanded the public health region. We took on the town of Boonton, and it's enabled us to actually increase our capacity to serve all 6 communities better with more resources by bringing them in. And at the same time, it's enabled us to reduce cost, which is is really not something you're hearing these days with the inflation rates and everything that we're seeing. Not only did we keep that at bay, we actually reduced costs substantially to all 6 municipalities. So that was really a coup, bringing and expanding the region. The second part is the award that we received, the grant funds. I was able to acquire an award of over $625,000. I was very excited by that, and we worked. We wanted to apply these to projects and purchases that aren't only for public health infrastructure, but actually could be broadly applied across all town operations. So I want to thank Mr. Brewer, who helped me coordinate with the other department heads to identify projects that are for public health, but also used broadly by all the other departments. And we identified some fantastic projects that we applied it to. Yeah, so it's across the board, that's been a great thing. And then we've also entered into a contract with Atlantic Health to augment our health education services, and they assigned a fantastic professional to us. We've been working together all year. She's really a dynamic person who's excited about what she does. We've gotten a lot of, we've put together some nice programs that are allowing us to do some outreach in the community. We've actually reached out to Hurl Village and some of the other senior clubs, not only here in Pequannock, but all 6 towns. We're looking at augmenting the school system's health courses, because they're not really touching on some of the things kids are dealing with now post-COVID. There's been a lot of mental health issues since COVID. There's been substance abuse and addiction problems since COVID. And we're working with the superintendents of schools in all 6 municipalities. I just had a meeting with Dr. Portis about a month ago. It was very productive. He was very pleased to work with us, and we're looking to put some programs together in the schools, not only for the students, but for the parents, about some of these emerging public health threats that people may not be aware of. And it's really incumbent upon the health department to bring these issues to the fore and try to have some kind of a program to address them. And so those are the additional achievements that we've had this year. We're looking forward to continuing this in the future with more things that we can do to connect with the community. And that's pretty much it. In addition to the summary, you've got volumes of paper with, like I said, the statistics and the numbers that you were provided. And that's pretty much it with the routine report.
Is it 5 or 6 towns that we...
Now we're at 6 towns.
So Bloomingdale, Florham Park, Kinnelon, Riverdale, and Town of Boone, which one am I missing?
Us.
Oh, us. Yeah, so I would think that Chilton should be, I mean, because 5 of the 6 are in Chilton's
Yes.
network area, so
Yeah.
it would definitely be wise for them.
And the rest are in Morristown.
Parker.
And, yeah,
Florham Park would probably go to Morristown Hospital, so.
and the health education services are based out of Morristown, and they do work here out of Chilton too. So it connects all the towns through Morristown and Chilton both.
Do you know the name of the
That works out
person
great.
that you're dealing with?
Yeah, it's Cassidy Dock is the health educator. She's been doing it for about 2-3 years, very enthused, and has some great ideas. Brings a nice, fresh view to what we're trying to achieve.
When did we say we brought Booton on board? How long have they been?
April. April was the first month that we brought them on.
That's why their numbers are lower, because it
Yes.
wasn't a full year.
Yeah. And going into next year, as I said, the fees for all 6 municipalities have dropped. So they were quite surprised when I gave the numbers. And so before if you have any other questions, if not, I'd like to delve into the legislation I'm interested in discussing that also has to do with public health threats that are emerging. They were already intensifying before COVID, but since COVID, it's gotten worse. And so I went through all the ordinances to see if there's any legislative approaches, in addition to the programs we're trying to develop, if there's a legislative approach to certain aspects of it. And I came up with actually 3 small but important changes I'd like to make to some of the ordinances that we have. There was a memo that I had sent to the board, and so if you want to take a quick look at that, I can show you on here what I'm suggesting. In the first section here, the changes I'm proposing are there's three changes to the existing ordinances. So the first is instituting reinspection fees, and reinspection fees really are a way to have an administrative fine to establishments that have failed inspection and have been downgraded to something less than satisfactory. When they're less, all the establishments, facilities, and institutions that we regulate, the reason we regulate them is they're not operating in a compliant manner. They're inherently dangerous to the public. So when they're downgraded from satisfactory to something less, there's a problem. And so rather than do re-inspections and try to, we educate is a primary thing, but sometimes you're dealing with businesses who are refusing to comply. And with that, the next option for us is to go to court. It's very time-consuming, not only for us, but for the business owners, and it just it sometimes ties up the court system. And so I've used this in other municipalities. It works very well where you can institute a reinspection fee right on the spot if it's something that has to be downgraded because of their failure to operate in a compliant manner. The fee would be equal to the amount they pay for their license. So whatever they pay for their license is what the fine would be. And we don't like to call it a fine, it's a reinspection fee, but it is equal to whatever license fee they're paying. That fee will continue until we can elevate them back to satisfactory status. So if we go back a second time and they're still haven't become compliant, they'll be given the fee again and again. If they fail to pay the fee, then we'll issue a summons for failure to pay the fee, and then we can also issue summonses for the citations that they failed to correct. And so it really intensifies our ability to do enforcement and get them on board much more quickly. Every day they're operating out of compliance is a day they're threatening the public. So this abbreviates the process. Court dates can sometimes be a month off. This is something you can do immediately. You get good results very swiftly. And once they get that understanding, you don't have to do it that often. It's really, they know it's there, they know it's something you can levy, and they're just a lot more interested in what you have to say when you walk in.
How does it work now if they have to be re-inspected? You just go back at a particular time?
Yeah, you just go back. It's usually unannounced. A lot of the times we'll give like we'll say you have a week to correct these items. Okay. So at some point after a week, we'll go back, or it's 2 weeks, depending on what it is. And then if they haven't done it, we say, okay, we'll give you, we'll give you another few days, but if not, we'll give you a summons, and it's like a negotiation all the time.
So it's better just to have the fee.
This way you can go back and say, look, I'm sorry, but there is a reinspection fee because we had to downgrade you to a conditionally satisfactory rating or an unsatisfactory rating, or if we had to close the place, that happens on occasion. These additional fees and fines hit them hard. So.
And I'm assuming that the license fees vary greatly depending on the industry?
Yes, it depends on the type of business we're regulating. And so, for instance, for the reinspection fees, we're looking to do it for body art, which is your tattoo, body piercing, and permanent cosmetics. We're also looking to do this with public recreational bathing facilities, so all the pools in the complexes and gyms and things like that, and then all of your food establishments. So this is what we want to institute for all these three categories.
Can we just do three categories? Isn't that like picking and choosing? Should we just do everything? Or can you just pick three?
Well, these are the main three that we actually inspect that present the most threat to the public if they're not in compliance.
Okay.
Just so everyone knows, this will, if these changes do come, they'll have to come in front of us as a resolution, and we'll have to approve them. We're not approving, these are just on Tom's wish list that he wants to do
Yeah,
tonight.
this is right. This would have to
2024.
come. For instance, Mr. Oostdike and I would have to go through the ordinances, figure out where we're going to place this. I have some drafts. They're only to give you, they're really, it's a concept only, to give you the concept of what we're trying to achieve.
But obviously the people...
But we would actually make this an ordinance, and then we would just do, when we go into a place, we're going to find them. We would find them on the spot. The other part of this, we want to really go through the definitions, especially with mobile food vendors, temporary retail food establishments, and farmers markets. We had a farmers market here in town. I don't think we have one right now, but it could reemerge. And there's a lot of confusion of how you're going to license farmers markets and how they operate. If you treat it like a temporary retail food establishment, every 7 days they have to come and get a new license. But the farmers markets usually run from like April till November. So we want to have one license that covers the entire period. So we want something specific for farmers markets, and we also want something to distinguish mobile food vendors from temporary retail food establishments a little bit better, because a lot of times the law is not being equally applied, and it's also creating a lot of confusion to the business owners of what license type they want to get. So we really want to sharpen up those definitions, and that way everybody's treated equally.
Does that include the trucks that we have out here?
Yes.
Like on a Tuesday? Okay.
Yeah, so they would actually be a temporary retail food, even though it's a
Yeah.
truck,
Right.
because they're not on a route.
Right.
But that's where some of the confusion comes in. So we're gonna make those definitions a little clearer. And then the last one that we'd like to do is, right now we are training food workers. They get a very cursory course that we give to their employees, which makes us managers in their business in a sense, because it's their responsibility to train the food workers. It's not our responsibility. And with this vicious turnover of food workers, they come and go in 2-3 months. So by the time you get to train them annually, you may have had 2 or 3 generations of food workers already, none of whom were trained. And because they're not trained, how many people were exposed to foods that were not prepared properly? So this change would remove that from the ordinance. We no longer have the health department training frontline food workers with a cursory kind of a course. But the establishments would have to actually have managers trained with this more extensive course. It's about a 16-hour training course. And each shift will have to have a food protection manager there. And they'll be responsible to, on every shift, have somebody present. When we do inspections, they'll have to show us who that manager is. The credential, the certificate, who's on shift. They'll have to show us their license to make sure it's the person whose placard is there. And that will go a long way to make sure everybody's trained all the time on every shift. And so that's the other part that we'd like for you guys to consider. And again, Bob and I will be going through all 3 of these changes, and then ultimately sometime early next year, the draft for your consideration will be presented.
Okay.
The last one, and importantly, we'd like to propose new legislation entirely in regards to electronic smoking device and psychoactive substance establishments. We want to actually create a new license type. Yeah, psychoactive substances.
That's an interesting word.
It is. I had to find a very one that encompasses, and that is a scientific term for any of these things. And the definitions in here of what psychoactive substances are, I put it into the memo just to give you an idea. But basically, these are drugs that alter your consciousness, and it comes in all forms. And so we'd like to put this, I have a draft there, it's about 15 pages. It's taken about 8 ordinances from across the state. I cherry-picked the best parts out, and then I wrote the glue that kind of pulls it all together. All 6 towns, everything here is being presented to all 6 towns, by the way. And so there's going to be Bob and Fred Semro's office will be taking a look at it. But I'm going to try to coordinate multiple attorneys to kind of put some kind of a model code out for all 6 towns. We'd be ahead of the curve, but it's important to do this because not only are kids getting CBD, which is actually cannabis because it's got more THC in it than it's supposed to, and people are buying vapes with CBD, but really it's cannabis. We have to identify these places that are selling gummies that are really cannabis related. They're not the legal form of CBD. There's also stuff like ketamine, which is a cat tranquilizer called Special K that comes in liquid form that gas stations sell and retail food establishments sell.
Crazy.
Liquor stores sell it, and kids are getting their hands on it. And most of these businesses aren't observing the age restrictions, and they're also selling things that are flavored like candy, cookies. The packaging is cartoon figures seniors. So these businesses are like predatory in a lot of ways to our kids. It's proliferating. It's a real hazard. I don't even think parents know what's going on out there because it's rapidly proliferating, and it's taking advantage of the mental state of our kids post-COVID, the addiction issue post-COVID, and it's incumbent upon us to try to counter this. So that's why I've put this legislation together, and I'll be proposing it with, Bob's help. I would say sometime in the spring, you should have it pounded out enough to present it to you for
We were
consideration.
just talking about the smoke shop, so if they're selling, it's ridiculous. They're not supposed to be doing that.
Gone a long way from sniffing bottle glue, haven't they? Gee.
So anyway, that concludes my reports.
Any other comments for the
Nah,
health
great
officer?
job.
Yeah, no, very good job.
Whatever you're doing a great job.
Keep it up.
Yeah.
Thank you. Thanks for coming out.
Carol, do I have to adjourn this meeting? Can I get a motion to adjourn the meeting?
I'll make that motion.
Second?
I'll second.
All in favor?
Aye.
Aye.
Thank
you, Tom.
Sorry.